Okay, so today we will be going over multiple sclerosis, as you guys wanted to do in the poll. Then we'll be talking about campus versus city universities. We got like a recommendation for that, so we'll do that. And then we're gonna go over some personal statement tips from our lovely education officer. We wanted to do schizophrenia, but we won't be able to do it this week because of technical issues. So hopefully we can do that next week. All right. Can I please have Letitia for multiple sclerosis, please?
Yes. Hello, everyone. Nice to see you again. Today I'm here again for this week's topic, which we're going to be looking at is multiple sclerosis, which is the disease that all of you wanted to see us talk about. So we will be going over the pathophysiology of the disease, which is essentially the physical I would say, steps that occur in our body that leads to this disease, the diagnosis, how exactly is this disease diagnosed, and the management of the disease. So I will be giving you an overview of the mechanisms that are involved with this disease, clinical features, ways that the disease can be diagnosed, and the latest treatment approaches that we have for this complex disorder. So, what exactly is multiple sclerosis? Now, most of you may already know this, but for those of you that don't know, it is a chronic autoimmune neurodegenerative disease. Chronic essentially means lasts for a long period of time, and autoimmune, in case you didn't know, is actually where the body's immune system attacks its own body cells. So, it attacks your own body cells, so it's not foreign, but the immune system recognizes it as foreign. So that's what's happening in multiple sclerosis as well. Neurodegenerative because it actually causes degeneration of nerve cells, causes a lot of inflammation, scars, lesions, which we will look at. So it's characterized by demyelination in the central nervous system. Demyelination, which we will look at more later on, is actually where the myelin sheath that covers the axons of neurons is destroyed. And this results in the formation of sclerotic plaques, which are actually, you can also call them lesions, which will be visible on the MRI of the brain when you take the scan, as well as on the spinal cord. And because the myelin sheaths are destroyed, this causes a disruption of neural signal transmission because myelin sheaths are essential for allowing fast impulse transmission. And essentially, they are involved in a process called saltatory conduction, which we will look at later on. And this disease involves the progressive accumulation of disability. So, the basic pathophysiology of this disease. So, like I said, pathophysiology is the physical processes in the body that cause this disease essentially. So, the first thing that happens is your immune system cells attack the myelin sheath on neurons. So we have autoreactive T cells, which you may have studied in A-level biology, T lymphocytes, which cross the blood-brain barrier and they recognize the myelin sheath as foreign. And this results in an inflammatory response like the immune system would do to any other disease. So pro-inflammatory cytokines, which are actually, there are two types of cytokines, but this type of cytokine promotes inflammation. So because these cytokines are released, more inflammation will happen, and the recruitment of B cells, which, as you know, produce antibodies if you've done A-level biology, macrophages, and microglia. Microglia is actually a type of cell that identifies any inflammation that's present. And this causes demyelination, where the myelin sheath that covers the neurons are destroyed. And because of this, saltatory conduction, which is actually the process by which impulses are transmitted across neurons, this will be impaired, which means impulses will not move as fast. And this causes axonal damage because the myelin sheath covers the axon. So when the myelin sheath is destroyed, this causes damage to the axon as well. And because of the destruction of the myelin sheath, axons are destroyed. So axonal loss occurs where these axons will die, nerve cells will die. This will also cause gliosis, which is actually something that happens where glion cells, they protect the nerve cells. More of them will be formed, and this will cause even more inflammation and atrophy, which is actually the reduction in mass of organs in your body. And all of this will result in permanent neurological deficits. Now, there are actually four types of multiple sclerosis They have different symptoms, can occur in different ages as well. Relapsing remitting MS is multiple sclerosis for short, is the most common form. So around 85% of cases are relapsing remitting MS. They have clearly defined attacks followed by partial or complete recovery, which means there are periods where you will experience a lot of symptoms and then periods where you will feel normal, will not experience anything at all. So there's actually minimal disease progression. So the disease doesn't progress, doesn't get worse essentially. Then we have secondary progressive MS, which is actually for people who tend to have relapsing remitting MS. It follows it is followed by secondary progressive MS, which means there are actually no periods of relapses. You're going to have a continuous period of symptoms, and the disease will continue to get worse progressively. And 60 to 70% approximately of patients who have relapsing remitting MS will transition to this form of MS. Then we have primary progressive MS, which means there won't be any form of relapses. Patients who have this will not have periods of relapse, around very few percentage, only 10 to 15% of patients tend to experience this form of MS. This actually tends to present much later in life, so around 40s and 50s. And the other forms of MS will actually be seen in your 20s, 30s, and 40s, so much younger. The last one is progressive relapsing MS, which is actually kind of the opposite of relapsing remitting MS. So there will be periods of relapses, but the disease will get progressively worse. And it's the rarest form of MS that you can get, and there will be continued progression of the symptoms between periods of attacks. What are the causes and risk factors of this disease? Now, again, this disease actually has no known cause. Scientists have not been able to find out the exact causes, but statistics do show that females are more likely to get this compared to males. So 3 times more likely for females to get MS compared to males. And as I mentioned earlier, 20s to 40s is the age where this disease will show its onset, and around 2.8 million people have this disease. Now, some factors have been investigated and they show a correlation. So genetic factors actually do play a role in increasing your risk of getting MS. So people who have this haplotype, as you can see over here, the haplotype is essentially a set of genes which you will inherit from a single parent. If you inherit this particular haplotype, you might have a greater risk of getting MS compared to other people. Family history now, if you have a first degree relative like a parent or a sibling that has this disease, you have a greater chance of getting it. And over 200 non-HLA risk loci have been identified. HLA is actually a type of gene which codes for a protein that actually allows your body cells to identify whether something is foreign or not foreign to the body. So in autoimmune diseases, what's happening is the immune system recognizes your own cells as foreign, which means there can be a lack of this particular protein in your body, but there are also so many other genes which have been identified to show an increased risk of getting MS. Now, aside from genetic factors, there are a lot of environmental factors associated as well. So EBV infection, which is actually the Epstein-Barr virus. This particular virus, if you've been infected with this virus, actually most of patients who have this infection will have a very high risk of getting MS. Vitamin D deficiency is when certain people who don't go out into the sun often, who are deficient in vitamin D, also show an increased risk of getting MS. And lastly, the geographical latitude gradient, which is where you're from. So actually, according to research, people who have Northern European descent, where Caucasians have a slightly greater risk of getting MS compared to others. Some of the common symptoms, as obviously this involves the neurological system, the nervous system of the body, so it will affect the nervous parts of your body. So that would mean your sensory parts, so visual, your motor, your feelings, and some more of that. So the first one we have is visual. So it can cause visual disorders because this can cause a disruption to impulses that go from your eyes. So certain diseases that can occur is optic neuritis, diplopia, and nystagmus. We also have motor problems that can arise because there may be problems with impulses reaching your motor organs, so your feet, your hands, so weakness, you can have spasms, foot drop, and similar other things. And eventually, some people can become disabled where they won't even be able to move. Cognitive impairments means impairments in your brain function. So memory impairment, you may have a much slower processing speed and impairments to executive function as well. So your thinking can be impaired as well. You may also have more fatigue, so debilitating exhaustion. You may be more sensitive to heat, and you will face exercise intolerance as well. So you might get more exhausted when you exercise. Sensory problems include paresthesia, Lhermitte sign, and neuropathic pain. And autonomic functions will also be impaired. So patients may have a loss of bladder control, so bladder dysfunction, bowel issues, as well as sexual dysfunction. Um, Now we're going to look at how exactly this disease is diagnosed. So this is actually one of the hardest parts because MS presents with symptoms that are common to many other diseases as well. So thorough examination and thorough tests need to be conducted in order to diagnose MS. So lesions need to be demonstrated because lesions are one of the major signs that a person could have MS, as shown in this picture here. So the first thing that they would do, as any doctor would do, is take a history of any neurological episodes you've experienced, conduct a comprehensive neurological examination of your movement, your sensory function, cognitive function. This is done in order to exclude any other diseases that are similar to MS or that can mimic MS. Then they will conduct an MRI of your brain and spine. So they will detect any periventricular, juxtacortical, infratensorial, or spinal lesions, which are basically caused by MS. They can also look for these other forms of lesions, which are T2 hyperintense and T1 hypointense lesions. And there's a specific type of lesion known as gadolinium enhancing lesion, which is an active lesion. This indicates that active inflammation is happening, which is a major sign of MS. We can also conduct cerebrospinal fluid analysis done by lumbar puncture. So certain proteins might be elevated in your spinal fluid. They also do check your cell count and your protein levels and the present of oligoclonal bands in your cerebrospinal fluid. And they also do look for any other signs like visual, somatosensory, brainstem auditory, any clinically silent lesions, and any demonstration of slowed conduction. Some recent advances in MS treatment have been happening as well because MS actually for a long time has not had many effective treatments, but there are many treatments which have helped slow the progression of the disease and focus on earlier intervention. So we have B cell targeted therapies, which is actually pretty self-explanatory because B cells are one of the major reasons why a person can experience MS because B cells essentially kill myelin sheath cells. So these therapies target those B cells which cause this disease. So we have two examples of B cell targeted therapies. So Ocrevus and Kesimpta, they target CD20 plus B cells, which is basically B cells that have the CD20 protein present on their cell surface. And these essentially therapies will target those proteins and can cause a destruction of those B cells, so the B cells will no longer be produced. And as a result, many people have shown reduced relapse rates of up to 95% compared to earlier therapies, which is a good thing. We also have AI-enhanced diagnostics, which is not surprising because AI has been contributing to many revolutions in medicine. Machine learning algorithms have improved detection of subtle MS lesions. So similarly to other diseases, AI can also be able to go through the MRI scans and detect any lesions which neurologists may not be able to detect. So this can also contribute to earlier treatment initiation and greater predictive accuracy. Remyelination strategies, which focus mainly on preventing the disease, essentially allow the formation of myelin where it's been destroyed. So novel agents have been used which aim to promote oligodendrocyte differentiation and myelin repair. So on the cells where this myelin has been destroyed, the myelin will be repaired on those cells. So this can help reverse disability so the person may not have to experience those symptoms. We also have EBV vaccine development, which is Epstein-Barr virus, as I mentioned earlier, which contributes to an increased risk of MS. So a vaccine is being developed, which can help prevent this disease from happening and therefore help reduce MS incidence. These are different management approaches that we have, as well as the different medication classes, as mentioned, so interferons, sphingosine modulators, anti-CD20 monoclonals, fumarate, and pyrimidine synthesis inhibitors. These all do sound complicated, but the simple mechanism is they work on inhibiting the immune system. So interferons mainly work on controlling the immune system activity. So they mainly work on destroying any lymphocytes which are present that can target the myelin sheath. Sphingosine modulators work on reducing the number of lymphocytes that are present around the brain and the blood surrounding the brain. Anti-CD20 monoclonals is something we looked at earlier, which is B cell targeted therapies. Fumarates is another group of drugs that does the same thing, and pyrimidine synthesis inhibitors, as their name suggests, inhibits the synthesis of pyrimidines, which are actually an important part of lymphocyte development and production. So as a result, less lymphocytes are produced. Comprehensive care has included these four categories. So we have neurorehabilitation, physiotherapy, occupational therapy for patients who are struggling to walk, movement problems, speech therapy for people who are struggling to talk. Symptom management involves targeted therapies for spasticity, which is spasms, any fatigue that people may experience, any pain. Psychological support can also be provided to patients who may experience depression and anxiety, so it can help them manage those as well. And other lifestyle modifications like vitamin D supplementation, because as we mentioned earlier, vitamin D deficiency is a major reason for the development of MS, focus on exercise and diet as well. Now this is the last part that we're going to look at. Last week we looked at Creutzfeldt-Jakob disease, and today we're looking at MS. So we'll just do a brief comparison between those two. MS is an autoimmune disease, as we mentioned earlier. Creutzfeldt-Jakob (CJD) is caused by prion protein misfolding, where prion proteins misfold. The pathology of MS is it essentially is caused due to demyelination, which leads to inflammation. The pathology for CJD is spongiform neurodegeneration. The course of MS is chronic. It lasts for a long period of time. You're lifelong, and it's usually relapsing, remitting, where there are periods of relapse and periods of no symptoms at all. Whereas for CJD, it's rapidly progressive dementia, so it eventually leads to dementia. For MS, people who have MS usually do have a near normal life expectancy as long as they have treatment, but unfortunately for CJD, people can only be able to live up to 1 year, and they'll usually die within a year of symptoms. With MS, when we look at MRI scans, we look for white matter lesions that are present. And for CJD, we usually look for a hockey stick or pulvinar sign on the MRI, which indicates a person might have CJD. And lastly, when it comes to treatment for MS, we have, as we saw earlier, disease-modifying therapies available. But the only option that we have for CJD is supportive care, because there are no options for treatment available as of far. So that's all for this segment. Thank you for listening.
Thank you so much, Litisha. That was very informative. Now we'll just be moving on to city versus campus universities, and this will obviously help you apply to universities very strategically so then they suit your learning style and your personality. So essentially what campus universities are is that all the university buildings and facilities, such as lecture halls, libraries, bars, gyms, and student residences, are located in one like same area. So despite its meaning, campus universities can still be in a city, an example being University of Birmingham. And some universities may have more than one campus, but campus buildings are generally closed off to public, and they're only open to like students and staff. So examples of campus universities are Aston University, Edge Hill University, University of Birmingham, University of Bath, University of Dundee, and Loughborough universities. And so some pros and advantages of going to a campus university is that everything is in one place. So you won't have to, have very long commutes to a class to the other one. And there's also a very strong sense of community. All the people around you, well, most of them will be going to the same university And you can find it easier to make friends and to have like more of a social life that is surrounded in a way with your uni and your studies. Peace and quiet is also very easy to find because it's a study environment everywhere, and there's also a lot of green space. Um, and I was looking at some student feedback while making this presentation from students that have been to university, and they said that they really enjoyed, having lunch in green spaces that the campus universities offer. And also, so for some cons, there's a lot of you need more effort to get out and explore the city or the countryside around your university, because you won't really find, new places as you commute to different classes daily. So you might have to like make more effort to maybe explore and go out and, try and look at the town or city that you're close to. You'll also be typically be based out of the town, which could be quite hard, especially if you're trying to look for like internships or employment or I don't know, any other opportunities. So you would be in a campus university, you would be quite isolated in a way. And like nightlife might also be quite limited because you only have a couple bars or a couple clubs that you could go to. And then so city universities, it's where it's in the name, all university buildings are scattered around the city, and this means that student halls might be spread about and not located in one place. But you will have to make like a commute to your classes. So examples being University of Sheffield, Oxford and Cambridge, University of Leeds, Derby, Manchester, and Nottingham Trent University. So some pros of going to city universities is that you'd be surrounded by a whole mix of people. So, you would experience social life with students, but you'll also have other um, like a whole mix of people. So maybe it's easier for you to make a wide range of friends, and you might have an even bigger social life than compared to campus universities. And there's always something going on because you'll be in a city, so you can go around and explore places just in your daily commute. Um, and obviously, there's going to be a more diverse nightlife because you will be more familiar with the place, so you can decide which bar you want to go to, which restaurant you want to go to. So it's a more sociable experience if you choose a city university. Some cons and disadvantages are that you may have to travel further to get to uni. So maybe one of your classes are a bit far away from where you are right now. So you will have to, keep in mind the travel expenses and what routes you travel from. And it's also easy to feel detached from your student's body, like your university student body, because you'll be in a city basically. And this might actually help you develop a sense of like you will get to experience what it would be like um, when you commute to work as like in the future. And there's also lots of concrete because you'll be in a city, and there's not going to be much green space, but that is not true for like Oxford and Cambridge because they are based in like a countryside um, area. And so factors to consider when choosing between campus and city universities is your academic goals. So the academic reputation of the universities itself is important, but also consider whether the university's setting hinders or facilitates access to internships, research, or specific industries. So as I mentioned earlier, campus universities tend to be more closed off. So you would experience a harder time to trying to access, jobs. Maybe you want like a side job or internships, but it's much easier in a city university because you can get to like, be familiar with the city and space around you. Um, and also you should consider your lifestyle preferences. So would you prefer a more close-knit, campus-centered experience or a more independent and urban lifestyle? Safety and environment are also very important. Campus universities offer more security because it's just in one, university student body, whereas city universities require more independence in navigating urban life. And this is where you can link it to your adult life when you have a job and you want to commute to work and find new opportunities. So that might help if you might get more experience with that if you attend a city university. And cost of living. So city-based universities often tend to have higher housing and daily expenses because you'll be traveling here and there with probably public transport. But that doesn't mean that campus universities are cheap either. Plus, commuting charges should also be accounted for. So how do you choose? So if you can, you should visit the universities on open days because you can get to experience the facilities, the teaching, the community, and also the environment firsthand. So you can see if you vision yourself in a place like that every day, studying. You could also try and speak to current students, which will help you get a feel of what students felt their experiences in uni was like. And this can also help you keep informed, and this can help you decide for yourself. You should also ask yourself personally, like, does your personality and study style suit the university that you want to apply for, and also the budget and expenses that you have. All right, that's all from me. And now I'll hand over to the education officer for personal statement tips.
Hello everyone, my name is Salma and I'm an educational officer. And today I'm going to be going through how to write a personal statement. So the first thing I want to address is that there have been a few changes to the structure of the personal statement. So for those of you who are applying this October, you'll be the first cohort to write the personal statement with the new changes. And so what has been changed is basically instead of just writing a whole essay, you just have to answer 3 questions. And so the first question is, why do you want to study this course or subject? And so in this section, you'd kind of want to talk about your personal experiences or driving factors behind your reason for wanting to study. You could also talk about books or podcasts you've listened to and how they've motivated you in wanting to study medicine. The second question is, how have your qualifications and studies helped you to prepare for this course or subject? So for this question, you'd want to be talking about how your subjects, for example, in school have given you a certain skill set that would be relevant to medicine. But you don't just have to talk about your subjects. You could talk about other qualifications or just things that you've done in general in school. For example, there's Olympiads like the biology and chemistry Olympiad, for example. And the third question is, what else have you done to prepare outside of your education, and why are these experiences useful? So for this question, this is basically talking about any volunteering you've done, any work experience you've done, and then reflecting on those experiences and talking about what you've learned from them and how they'll be useful to studying medicine in uni. And just one thing to consider for personal statement, you have a maximum of 4,000 characters, and that's including spaces. So what you want to be doing is you want to be you want to be mindful of how much you're writing because you want to talk about the more important experiences compared to the less important ones. So why do personal statements matter? Personal statements are a key part of university applications, some more than others. So I think we've mentioned before about weighting. For some universities, they will read your personal statements and it will affect how likely you are to get an interview. For other universities, they won't read it until they give you an interview. So it really depends. So maybe have a look at the university websites and see what the weighting is like. And the second reason is it helps you showcase your skills, your experiences, and your passion. And that can be really helpful in helping you get an interview with the uni. And it also kind of gives you things to talk about in your interview. And the third reason is it's an opportunity to stand out from other applicants. There's loads of things that you need to do to get into medical school. So you have your UCAT, you have your grades. So your personal statement is an opportunity to stand out from other people who have similar scores to you or similar grades to you. And a piece of advice I would have is to go to open days, and look at universities before you start writing your personal statement and ask what they want to see in your personal statement. So this is more for the first question, so why you want to study the course. So make sure you show passion for the course you want to study. So in this case for medicine, don't just list books or achievements that you've achieved. Make sure that you're actually talking about what you've taken from the book you've read or what you've learned from the achievements. You want to show your ability and your enthusiasm for the subject, and you want to be able to demonstrate deep engagement with your subject. Make sure you're concise and confident. As I've said before, there's a limit on the number of characters you have. So write clearly and stay on topic, and make sure you're avoiding long, vague sentences. I know it's very tempting to use all these long, fancy phrases, but you'd rather talk about your actual experiences than do that. And never start a paragraph with a weakness. Instead, you want to talk about what you're working on improving. So planning your personal statement, it's really helpful to make a bullet point list of everything you've done, and under each one, add the skills that you've developed and then flesh them out into full paragraphs. And it's also really useful to talk about what you've learned from your experiences. So for example, if you're doing work experience for 3 days, it would be really good for after each day to kind of write what you've taken. So for example, volunteering at a care home, you would have learned empathy, communication, and patience, among a list of many other skills. And you could write, while volunteering at a care home, I supported residents with daily tasks requiring patience and empathy. And this experience improved my communication skills and deepened my understanding of working with vulnerable people, essential qualities for a medical student. And this is how you could structure your work experience. So first you want to talk about what you did, and you want to talk about a specific situation. So don't just say, oh, I went to a care home and I did work experience. Talk about a specific experience that you had in the care home. And then you want to explain what happened in that situation and the actions that you took. And then after that, you want to talk about the outcome and what you learned from that experience, how you felt, and the impact that it had on you. And of course, you want to talk about the skills that you developed. So whether that's communication skills or empathy. And I think one of the most important things is linking it to the future role. So in this case, a doctor. So in paragraph 1, you could say you observe nurses showing empathy and communication. Paragraph 2, volunteering helped me develop those same skills. So basically what that means is it's good to link back to your future career, even if it's non-medical. So this is an example of a medical-based experience paragraph. So I further developed my empathy and communication skills during work experience at Warwick Hospital, where I was conversing with patients from all walks of life. Whilst talking to a patient's loved one, I used nonverbal cues to show that I was actively listening to his concerns about his wife's treatment. This experience highlighted the importance of treating and addressing the concerns of not just the patient, but also their families and friends. Being empathetic and having the ability to adapt my communication would allow me to take a more holistic approach when treating patients as a doctor. And then below I have an example of a non-medical based, of a non-medical based experience writing. So furthermore, completing my diploma for both baritone, oh gosh, I'm so sorry guys, I don't know how to say that word, and Carnatic singing enabled me to develop my time management and organization skills, as I had to establish schedules and work towards coursework deadlines. Continuing to develop these skills in the medical field is essential, as it will allow me to manage the challenging responsibilities, creating a sustainable work-life balance. So for this paragraph, what the person's done is they've taken a normal experience that's not really related to medicine, and they've shown how the skills that they've learned from their experiences link to being a good doctor in the future. So here are a few examples of skills you can showcase throughout your personal statement. So empathy, communication, teamwork, problem solving, teaching, reflection, leadership, time management, and organization. And those are only a few of the really long list of skills that you can include in your personal statement. So just some final advice from me, start early and plan ahead. You don't want to be leaving your personal statement to the last minute because you will need to write more than one draft and there will be space for more improvement. Use real life examples, not just vague claims. They will find out in the interview whether what you've said is true or not. So make sure you're trying as much as possible not to lie in your personal statement. Connect your skills to your subject or your career and keep the tone positive and proactive throughout your personal statement. And make sure you let your passion and your personality shine through because remember, the personal statement is an opportunity for you to show them what you're like pre-interview. Uh, thank you. And that's it for this segment.
Thank you very much. That was very useful. So that's the end of the seminar this week. I'll leave the attendance form in the chat, the link. And also, one thing I wanted to mention is that next week we will be having people from med camps who will be talking about, they'll be going over like a 3-week course where they do like the weekly seminar we have. They'll be taking that session for 3 weeks and we'll be going over how to write a good personal statement. So they'll start with like how to actually introduce yourself in the personal statement, how to start, and also how to end. And it will be like a whole course. So I organized that for you guys, and hopefully we'll find it very helpful. And so just fill in the attendance form, and I'll give you more updates and information on the community page when I get more. So yeah, thank you. We'll be waiting here if you have any questions.